Your kidneys are not merely filters, they are highly intelligent organs responsible for balancing fluid levels, retaining essential nutrients, and removing waste and toxins. When these organs become overloaded or damaged, toxins begin to accumulate in the bloodstream, which can negatively affect your heart, brain, nervous system, and immune function. Below are 13 critical warning signs that may indicate your kidneys are toxic or experiencing decline, progressing from early symptoms to more dangerous, advanced stages. Early stage signs, reversible if detected early. 1. Changes in urination. You may notice increased or decreased frequency, dark or foamy urine, cloudiness, or even blood. This occurs because impaired kidney function disrupts the delicate balance of pH, sodium, and potassium. 2. High blood pressure, without a clear cause. Since your kidneys help regulate blood pressure by managing fluid and electrolyte levels, a decline in function causes sodium retention, which in turn increases blood volume, placing additional pressure on the heart and arteries. 3. Fatigue, low energy, and difficulty concentrating. Your kidneys produce a hormone called erythropoietin, EPO, which stimulates red blood cell production. When EPO levels drop, mild anemia can occur, leading to reduced oxygen delivery to the brain and muscles, causing fatigue, dizziness, and mental fog. Fourth, metallic taste in the mouth and ammonia, scented breath. As urea and other waste products accumulate in the body, they may alter your sense of taste and lead to a breath that smells like ammonia or urine. This condition is often accompanied by itchy skin or rashes. 5. Swelling in the ankles or under the eyes. Kidney dysfunction may cause fluid retention or lead to the loss of protein, like albumin in the urine. As a result, you might notice puffy eyes, swollen feet, or in more serious cases, fluid buildup in the lungs that causes breathing difficulty. 6. Muscle cramps and spasms. An imbalance in electrolytes such as sodium, potassium, calcium, or magnesium can lead to frequent nighttime cramps and painful muscle spasms. This is a particularly common symptom in moderate kidney disease, stage 2 to 3. Seventh, frequent nighttime urination. Even if your fluid intake in the evening is minimal, needing to urinate frequently at night can signal a reduced ability of the kidneys to properly concentrate urine. Mid-stage signs require medical monitoring. 8. Protein in the urine, proteinuria. When the glomeruli are damaged, proteins like albumin leak into the urine. This is a key early indicator of chronic kidney disease. 9. Vitamin D deficiency, bone loss, and joint pain. Your kidneys are responsible for converting vitamin D into its active form. When they fail to do so, even with supplementation, calcium absorption becomes impaired, which can result in weak bones, kidney stones, and arterial calcification. 10. Highly acidic urine, low pH. As kidneys lose the ability to regulate acid-base balance, the body becomes more acidic, a condition known as metabolic acidosis. This is particularly dangerous for individuals with poorly controlled diabetes, as it may lead to ketoacidosis. Advanced stage signs, potentially life-threatening. 11th, cognitive decline, memory loss, and brain fog. The accumulation of waste products in the blood can cross the blood-brain barrier and impair brain function. As a result, you may experience poor concentration, confusion, or slower thinking. 12th, shortness of breath and irregular heart rate. This can be caused by fluid leaking into the lungs, pulmonary edema, anemia due to reduced red blood cell production, or metabolic acidosis, all of which reduce oxygen availability and may increase breathing rate to compensate. 13th, uremic frost, white crystals on the skin. Although rare, this condition results from urea being excreted through the skin in the form of a white, powdery substance, usually on the forehead or scalp. It signals a near complete loss of kidney function. Common causes of kidney damage. 1. Diabetes, especially with long-term elevated blood sugar. This can damage kidney blood vessels, much like sandpaper scrapes away delicate tissues. 2. High blood pressure, due to diabetes, vitamin D deficiency, or low potassium. 3. Overuse of medication or exposure to harmful chemicals, including NSAIDs, antibiotics, and diuretics. 4th, excess intake of high oxalate foods, like spinach, beets, kiwi, almonds, and beans. 7 natural ways to protect and support kidney function. Reduce intake of refined carbohydrates, sugars, and highly processed foods. Increase potassium intake, only if you're not in late stage kidney disease, through foods like leafy greens, avocados, and squash. Drink at least 2.5 liters of clean water daily. Avoid unnecessary medications, excess caffeine, and pesticide laden produce. Incorporate foods like parsley, celery, asparagus, kale, and well cooked spinach. Kidney failure doesn't happen overnight. It's often a silent process that develops over many years. Fortunately, if detected in the early stages, 1 to 3A, kidney function can often be stabilized or even improved without dialysis. Pay attention to these warning signs, listen to your body, and take preventive steps. Remember, your kidneys are silent workers, but they are absolutely irreplaceable.